the way this organization, this foundation has worked with me has worked in a way that it has protected the patient's identity. Those who do not want to be contacted, no one knows they have diabetes. And those who do want to be contacted, we ask permission first and tell them there's this organization in town who, started several years ago, and they're here to help you get through the beginning of this, journey you're going through with diabetes.
It gives a resource for patients and for their parents and their caretakers and their families to get the correct information, because they are getting a tremendous amount of misinformation from our society in general. And we're not trying to step in and do the job of the endocrinologist or diabetes educator that patient's already working with. We're here to support them, and we always refer back to their treating endocrinologist and diabetes educator when they have specific issues and concerns.
I'm the only pediatric endocrinologist in this area. Unless they're traveling far away, such as Dallas or Houston, really most of them are coming here. And so they're all being channeled to the same foundation, to the same support group.
Having all the moms that have to get up and do blood sugar checks at 2 or 3 o'clock in the morning, let them know who each other is, get them in contact with each other. They can call and scream on the phone, cry, express their emotions. That's one area where, as healthcare providers, we really don't get enough time to do that.
The psychosocial aspect of dealing with the diabetes and the family dynamics, and what do you do in the middle of the night, what have other families have tried when certain situations arise. Those things only come from real life experiences, and the ones to best help these families are families who already have kids with diabetes who have been through it.
We use a lot of social networking, which works great, so that if a family or a mother or father has that question at 3 o'clock in the morning, usually there's going to be someone that they can communicate with or even call.
They get on the Facebook and they get on the webpage and they go to the meetings. They really seem to really enjoy it and keep coming back for it.
Grandparents, caregivers, we've had lots of school nurses come to get educated, which is so important. Anybody from the community is welcome to come learn more about type 1 diabetes. So you can't find that anywhere else.
I hear when they come back after they're newly diagnosed, and they tell me, I went to that first support group you told me about, and it was a great experience. I got to meet other families. I got to meet other parents. The kids had a great time. They got to meet other children who had diabetes and interacted with their siblings, and it was a great experience. And I've had all just positive comments from every family who's gone to the meetings or who I've met the other families from the foundation.
Type 1 Diabetes Foundation fills a need that you can't find anywhere else. It just didn't exist. Which is support and structure at the time of diagnosis.
I found in other conditions where there's been a family member with a very rare condition, and you tell a new family, there's somebody out there who can help you, here's their phone number, they've given me permission for you to call them. Oftentimes they don't make the contact. When when the organization is contacting the family, they're kind of, it's there, it's real, someone's now talking to them. And when they come in, fairly soon, within 24 hours, 48 hours, when it's still fresh, when they really need that initial support the most, I think it really helps. When you do one-on-one, sometimes you don't get that kind of interaction. And so I think it is a good service that helps enhance what we're doing already here.
It's the only one that provides support at a local level. And not just support, really good support, really hands-on support, ongoing support, and education.
Before this, we used to try to find a family in their area that had diabetes and contact them and say, would you be interested in talking to a new family? And sometimes it's harder because that family may not be, they want to help, but they're busy and they've got other things going on, and so it's a little harder to try to organize, and it's a lot of my time. This makes it easier. I just call Margie, and she takes care of making sure somebody's out there to visit the new family. And when somebody just hands you a basket and says, here's all you need, here's what worked for us, it really helps alleviate some of the stress that they already have.
Being plugged in, having, I call it kind of that touchstone back in your own community, it does keep you plugged in, because I deal with a lot of patients that have type 1 diabetes that are now in their 20s or 30s or 40s. And I sit down to work with them for the first time and I said, hey, when's the last time you had any education? When's the last time you worked with a diabetes educator? Well, when I was diagnosed when I was 12. And that just breaks my heart, because they've gone through many years without being plugged in and without getting the information that they need in their care, and their management of their disease suffers. So having this in a local community where people can stay involved, get ongoing education, is vital emotionally to the families and vital to the outcomes of the patients as well.
They become each other's families. They become my family. I think it's all very much intertwined. When one kid's in the hospital, all the families find out. In fact, I find out things about other children through other families. So it really is. It's a nice, close-knit network that has started and is growing, and I think that's amazing. I think it's very unique, and I think it really enhances the care that I provide to them as well.